Hello, I'm Dr. Kathleen Wills of the Optimal Wellness Limited Centre located in Epsom, Auckland, New Zealand. I'd like to talk with you today about a very common condition called intestinal dysbiosis. This is a difficulty of the gut and the flora in the intestines of the gut. So today I would like to go in this particular order. I'd like to define to you what intestinal flora are, what the condition of intestinal dysbiosis is, the causes of intestinal dysbiosis, some of the symptoms you may experience, and then how do we go about curing this condition. So some dietary recommendations will be provided, as well as some recommended supplements. So firstly, I'd like to explain why you can get intestinal dysbiosis. Your intestine is full of a very complex system of flora, which include yeast, bacteria, such as E. coli, all sorts of intestinal flora. Some of them are good, others are not good. Now, when there is an imbalance in the gut of the good flora and the bad intestinal flora, this becomes an issue. This is what is called intestinal dysbiosis. With intestinal dysbiosis, it is becoming increasingly common in our westernized societies to be affected by these, even by our psychological stress can bring this on, antibiotics, physical stress. All of these types of lifestyle conditions can affect the balance of flora in our gut. Now, the causes of intestinal dysbiosis can be numerous besides psychological and lifestyle choices. We can also get dysbiosis with dietary measures. So if we have high fat, high sugar, low fiber diets, along with food allergies, and also eating a lot of carbohydrates that are simple carbohydrates, this can lead to problems in the balance of the gut. Digestive enzymes that are perhaps not readily available in the gut can cause this problem, as well as mentioned before, stress, lifestyle factors, decreased gut motility, xenobiotics, such as pollutants coming from the environment. Perhaps you drink out of a water bottle that is made of chemicals that your body takes in and has difficulty processing in the gut. Antibiotics can destroy the good flora in the gut. Malabsorption problems, perhaps you're not absorbing your foods and your nutrients into your intestines properly. Intestinal infections can also be a problem. You may pick up a parasite if you go overseas, or perhaps if you like to eat out, you can pick up some types of parasites and bacterias. So these are the main causes of intestinal dysbiosis. The intestinal symptoms include, very common ones are diarrhea, burning when you're passing, bloating, cramps, constipation, and foul-smelling stools. Those are the most common complaints. However, it can be more serious actually. You can have brain, joint, and muscle issues such as headaches, insomnia, behavioral disorders, learning disorders, joint pain, inflammation, chronic fatigue, and severe nutritional deficiencies. So, for example, we do have yeast in our gut. It's called Candida albicans, and this candida, if it perpetuates to a higher level than the gut should be allowing it to, we can get actual mood problems and behavioral problems, particularly autism, depression in both children and adults. So these can be quite serious conditions that are all related to intestinal dysbiosis. Now, the good part is we can actually work with you to rid yourself of this dysbiotic state and get back to regular functioning intestinal flora. I can recommend to you a diet that will help you very much to regulate the flora in your system. One of the most important things is to decrease your amount of sugar in your diet. Eliminate fruit juices, lollies, those types of things that we get used to having as comfort foods. Chemical additives can really irritate the gut. So things such as MSG, artificial sweeteners, these types of things that enhance the flavors of food but are not necessarily good for your gut. Empty calories, you need to cut back on your carbohydrates as those just turn into sugar, and sugar irritates the gut. Poor quality foods, perhaps you're not eating fresh, whole, organic foods, you're eating more processed, canned foods. And drinking water is a very interesting one because it's very important that you have pure drinking water. It's very good if you can have spring water or even distilled water for a couple of months at a time, just to clear the body of those bad flora. The other thing that's quite good to do is if you eliminate all nightshade vegetables, go gluten-free. It's quite essential if you're having severe abdominal pains, cramping, and diarrhea. So gluten-free is very good. And also to avoid all genetically modified and hybridized foods. This includes a lot of soy and corn products, so it's important to read the labels and maybe do a bit more shopping in a Whole Foods type of shop. In terms of supplements, we can help you out with some very good supplements for your condition. Bile acids are very important. They're all natural, and when your system is not functioning properly, your intestines, oftentimes it's because the bile is not functioning properly from the liver. So if we give you bile acids, that can stimulate the liver to produce it naturally. And then you can take yourself off of those bile acids when your liver is functioning properly. We can also support the liver with pancreatin. For your gut, some probiotics. We can also look at eliminating toxic metals from your body. We can do testing for heavy metals through hair analysis and blood analysis to look at to see if you have any metals that are infiltrating your intestines and causing issues. And finally, it's just you need to have a lifestyle change is the most important thing. Once you get the supplements, once you change your diet, lifestyle modification, decreasing your stress levels, and enjoying your life. So that's what I would like to share with you today. I hope you've enjoyed this. Thank you. I'm Dr. Kathleen Wills.